We don't have transparency in pricing. So if you, for example, want to have a cosmetic surgery in America, you can call 10 cosmetic practices and say, hey, I want to get a nose job. What's the cost of a nose job? And they will tell you their price because they don't have to negotiate with an insurance company, that you have to pay them. So you can get fair pricing and you could choose the one that you think is the best value. But good luck calling hospitals and saying, hey, I need an appendectomy because I have appendicitis. Which one is going to give me the best rates? They won't be able to give you that because they have different prices for one insurance. They have an agreement with this other insurance, and it's a disaster. It's hybridized so far. It's almost like a mutated system. It started off in one way, then someone had another idea to bring one approach, then someone had another approach, and now it's so segmented. This is largely driven by lobbyists who come in and start lobbying the government to say, oh, we need multiple insurance carriers. We need these rules for insurance carriers. And as a result, if you walk into my practice and I tell you you need treatment A, I can't even tell you what the cost of treatment A is because it's so dependent on variables that are outside of my control because it depends. For example, if a patient comes in and they tell me they fell and I write that in the chart, patient fell, blah, blah, blah. In the note, I say, oh, they fell at work. They were doing X, Y, and Z. And I finish the note. I send it to their insurance carrier. Their insurance, their health insurance might deny that claim and say, what do you mean they fell at work? You said in your note. That means the workers' compensation has to cover it, not us. The same thing will happen with a car accident. A patient will come to see me and they'll say, my back hurts. But in the note, they'll say, oh, I had a car accident 4 years ago. The insurance will deny it and say, the auto insurance is supposed to pay for this. So it's a complete disaster in terms of care. You cannot imagine a more broken system. And the fact that it still somehow works to some degree is magical. Doctors in demand realize that working with insurance companies will yield a lower profit than working with individuals who have cash who want on-demand service. They leave the insurance game and they say, I'm only going to accept cash payments from now on. And that way they know exactly what they're getting paid. They don't have to argue with insurers. And as a result, they are more financially successful than doctors who accept insurance. In ERs, it's very common that a hospital system would contract an ER employer who then has a bunch of ER doctors that work for them, and then they'll just place them at certain shifts at different hospitals. So they don't even work for the hospital. They work for the ER employer who then puts them in different staffing locations. And then you have private practices. My dad currently is a primary care doctor and he has a private practice. Those are getting bought up by hospital systems. They'll pay the provider a small amount of money or a large amount of money, depending on how successful the practice is, and then say, okay, we essentially own all of your patients. They're members of our practice, so that if you refer patients, it should be within our system, et cetera, et cetera. And now all of these smaller doctors that used to run their own sort of shops, if you will, are now part of a great health system, like a bigger health system. So there's less and less individualized practices. There's like 10 different insurance companies that have 10 different rules. So when a patient comes into my practice, I'll fill out a note and then I have to bill that note to the insurance company. But let's say I write a code for their condition that, let's say, doesn't fit the test requirement that they have to pay for that blood test. The bill will go to the patient. The patient will say, what the heck? Why is this not being covered? And it's because the insurer didn't like the code that I put. So this creates this huge administrative burden on doctors where we're like, screw this. We don't want to practice this way. We want the hospital systems to take care of it. But then when hospital systems take care of it, it loses that personal touch that you have with your doctor because now essentially you're a contractor being contracted to see a patient every 15 minutes. The cost of healthcare in America has ballooned over the last 20, 30 years. And it's not because doctors cost more to the system. In fact, doctors' cost to the system has stayed pretty stable or has gone up slightly with the cost of inflation. But the idea of healthcare has skyrocketed because for every doctor, you need like 10 to 15 administrators. You need a person to argue with the insurance company. You need a person to make sure the billing is right from the doctor's side. You need someone doing prior authorizations to argue for your patients to get certain tests done. It's literally a disaster. Some people will say universal healthcare is the solution. I think it could be a potential solution, but there's no one-size-fits-all answer because some people will say, well, universal healthcare isn't free healthcare. It's still paid by somebody. It's paid by us, the taxpayers. Some people will argue against that. And if we're being honest, whatever the government does usually isn't the most effective or efficient way of doing things. You could easily see more troubles arise in that scenario as well. Insurance costs have gone up. They wanted to make it seem like they didn't. So the insurers are really good at hiding the costs from you of what your care actually costs. So what they do is, let's say 10 years ago, you would pay $1,000 a month for your health insurance. But at that time, you had some copays, which were small, and no real deductibles. Now, you'll still pay $1,000 a month for your insurance, but now the first $5,000 you have to pay, which is your deductible. So the cost is tremendously higher, but when you're making your monthly payments, you don't even realize that it's higher. So insurers, instead of making less money because they're not efficient at handling our healthcare system, they just push the cost burden back onto the consumer. Always argue every bill. Every bill. The reason why is a lot of times it's an error on coding. I didn't write the code that would get your test covered as a doctor because I have no idea. Someone in administration can change the code and get it covered. That's number one. Number two, when health insurers charge you a fee, and let's say you're paying out of pocket for a condition, like you have no insurance, and you go to the emergency room, and the hospital charges $100 for an emergency appendix removal. They have to charge you as a cash user the same amount by law in order to charge it to the health insurance company. But they know, the health insurance company, why they're charging them $100, because they'll only pay them $60. So when you get the bill for $100 and you argue, they'll right away lower it to $60. They just can't do that by law, but they can do it if you claim financial hardship. Always argue your bills because a lot of them are mistakes. And if they're not mistakes, there's financial support programs. My hospital system that I work for is a nonprofit, and we have a charity care system in place for those who fall below the poverty line or near the poverty line. I see patients all day long that are either seeing me completely for free, are getting scans done completely for free, getting surgeries for free, getting scheduled with specialists for free. There are systems in place. It's just a lot of people aren't aware of those systems. They go underutilized.